take a really good look at the animal-human interface and the fact that animals from the wild are being brought into wet markets. You have animals that come out of the wild that are sold at these open, what they call them, wet markets. Wet markets, where you bring animals in from the wild who have these viruses. The wet markets in Asia, where people bring animals from the forest into market. There are wet markets in Wuhan that are ample opportunity for a virus to jump from an animal. The origin was from a bat to an intermediate host to a human, very likely in a wet market. And those animals should not have been in the Wuhan market. They knew that those animals should not have been in the market, and they immediately cleaned out the market, put restrictions on the kinds of animals that come into these wet markets. I think they should shut down those things right away. I mean, it boggles my mind.
Hey everyone, welcome back to Congress Daily Report, your trusted channel for real, raw, and unapologetic political breakdowns. Today, Senator Josh Hawley puts Dr. Anthony Fauci under intense pressure over his pandemic-era actions, federal employees, and controversial cash awards. Like, share, and subscribe, and watch until the end because this confrontation gets heated. Let's get into it.
We'll begin by asking unanimous consent to insert into the record documents show that the CIA transferred funds to NIAID through interagency agreement. Hearing no objection, so ordered. We had hoped to hear testimony from Anthony Fauci today. We haven't, but I think it's important that we do hear from him. So we will have a video we'll play in a moment. For years, Anthony Fauci has been the public face of saying this in all likelihood came from nature. He kept saying, it's the marketplace, it's the marketplace, it's the marketplace. He's been saying that on television up until recently. But what we find is that what he was saying in public is different than what he was saying in private. In January, in private, he wrote that looks like the wet market was a super spreader event. It didn't originate there. We know that some of the earliest deaths and sickness came from somewhere else. But then for years and years, we got dishonesty. So let's play the video so we can see a little juxtaposition of the problem we're dealing with.
Fauci's journal entries contradict what he said publicly about the origins of COVID-19. Fauci admitted in January 2020 that the initial outbreak of COVID did not occur at a wet market.
Take a really good look at the animal-human interface and the fact that animals from the wild are being brought into wet markets. You have animals that come out of the wild that are sold at these open, what they call them, wet markets. Wet markets, where you bring animals in from the wild who have these viruses. The wet markets in Asia, where people bring animals from the forest into market. There are wet markets in Wuhan that are ample opportunity for a virus to jump from an animal. The origin was from a bat to an intermediate host to a human, very likely in a wet market. And those animals should not have been in the Wuhan market. They knew that those animals should not have been in the market, and they immediately cleaned out the market, put restrictions on the kinds of animals that come into these wet markets. I think they should shut down those things right away. I mean, it boggles my mind.
So repeatedly saying in public something different than what he believed in private. Now this is interesting because, you know, the first SARS outbreak in 2003 was traced to a wet market, to animals there. But interestingly, they had evidence. They had evidence that the animals had the disease. They also had evidence that the handlers had a disproportionately high number of antibodies to the disease. So there was evidence, and the evidence was presented. So when this came out, the same thing happened again. They did look at the wet market. They looked at the wet market and tested, I think, 80,000 animals and didn't find any animals that had COVID-19. When they did find COVID-19 and trace samples there, they found that the DNA or the RNA was consistent with human spread. This was known not later on, didn't take years to develop, was known in January of 2020. And so Dr. Fauci says privately he knows it didn't come from the wet market, but as you saw, those were over a multi-year period. One of the other discussions I've had with Dr. Fauci over the years about natural immunity. So most infections, you get a degree of immunity, not perfect, some fairly perfect. Smallpox, you just don't get again. George Washington knew this. He had his wife get vaccinated, but he didn't because he'd already had smallpox. But there's one particular story that a man came up to me who'd lost his wife to COVID. He said, we all got it. We all got sick, and my wife ended up getting sick enough to go to the hospital. But we'd recovered 2 weeks. She was still alive. 2 to 3 weeks later, we'd all recovered, and they wouldn't let us be with her. And to this day, it's one of the saddest things. And it just, I think all of us should think about this. They were not allowed to visit their mom. He wasn't allowed to visit his wife in the hospital. But based on this misunderstanding of natural immunity, that for some reason 2 weeks later they were a problem. But this was all promulgated by you. We had the workers in the meat factories. They were essential. They had to keep working. Most of them got COVID. They got it in the first couple of weeks. Most of them were younger. The reassurance should have come from public health. The reassurance should have said, congratulations, you've recovered. It also should be acknowledged. What's the number one thing we can do if we get another pandemic? Before we have a vaccine, before we have monoclonal antibodies, it would be to utilize natural immunity. So instead of the advice you were giving to Cuomo and others in New York that led to the deaths of hundreds of thousands of people or tens of thousands of people, you could have been saying, well, maybe the nurses taking care of the elderly should be people who are 2 weeks out from COVID infection. We could have used natural immunity as somewhat of a block of protection. Imperfect, but the only protection we had and the only thing we could have done. Instead, the nursing homes were seated with people who had COVID. So I think the discussion of natural immunity is one where there wasn't sufficient honesty, humility, there wasn't enough presentation to encourage people. That was the only encouraging thing we had for a while is you've got it, you're very, very, if not impossible, close to impossible chance that you'll die if you get it again. Everybody could have been reassured. Nobody was reassured. It's like, well, we don't know. We just don't quite understand natural immunity. My favorite quote from that is from Martin Kulldorff from Harvard. You called him one of the people that you had to take down, the fringe epidemiologist, which I've never ever heard a scientist call another scientist that. But he jokingly said on Twitter, he said, yeah, we knew about natural immunity from 486 BC, from the time of the Athenian plague. We lost all knowledge of it in 2020. The good news is it's slowly coming back. 24 to 2025, we're beginning to understand what natural immunity is again. Not something perfect, but a useful tool that could have been used, but also something that could have helped people by telling the public, my goodness, you're not going to die now. You have a chance. If you've already had it and you're 85 years old and you're at risk for it, and you're wanting to feed your wife, and they're telling you to wear 4 masks and not be around your wife when you've already had it, it made no sense. I visited with a man whose mom was 83 and she was dying from COVID. They go to the hospital in Orange County. They won't admit her to the hospital till she's vaccinated because we have a policy that everybody in the hospital must be vaccinated. She's got COVID and they wanted to vaccinate her again. At one point in time, the CDC understood this. They told people, don't get vaccinated if you've had COVID within 3 months. Why? Because it may give you a heightened immune response when you've already got a heightened immune response. But giving a person very sick, and many of the people who died from COVID died from sort of this storm of response, this immune storm. The answer wouldn't be try to stir up their immune response more by giving them a vaccine. The answer was actually steroids. And good old-fashioned steroids, 37% reduction in death. It turned out to be way more valuable than remdesivir, way more valuable than any of the other treatments. But I don't remember ever hearing a complimentary word on natural immunity or steroids or anything else. And I wish we could have done more today. I would have been willing to accept an apology today. I'm sorry I made mistakes. We all made mistakes. And, at the time, I thought the gain of function research was, the risks of it were worth the benefits. But I've reassessed since 15 million people died. People say, well, gosh, these things never happen. We know it happened in 1977. We know with 100% certainty a virus escaped. In 1977, there's something called the Russian flu. Nobody's exactly positive how it got out. But when they sequenced it, they found out that a flu in 1977 had exactly the same RNA as a 1954 one that they had in the lab and they had created a vaccine for. In fact, turns out anybody born before 1954 was immune, and the only people who got it were people who had been born between 1954 and 1977. But it was identical. The genetic sequence was identical to this vaccine or the virus from 1954, and that doesn't happen because these respiratory viruses are always mutating. To be identical means it had to have leaked from the lab, proof positive that it had. So we know this happens. An author by the name of Young wrote a book and said there was 1,200 cases of significant accidents that have occurred. We knew all of this, and yet it was completely discounted because I think you were worried that if it was seen that you funded dangerous research that started the pandemic, you'd get blamed. And it was a concerted effort. It wasn't just you. Anybody associated with the funding decided we needed to protect ourselves.
Folks, this is one of those congressional moments where the real story isn't just what was said at the hearing, it's what was said then, compared with what we're hearing now. Senator Rand Paul came into this hearing with a very clear message. Americans deserve answers about the decisions that shaped the COVID-19 pandemic. And because Dr. Anthony Fauci wasn't there to testify directly, Paul decided to use something that can sometimes be even more powerful in a congressional hearing: Fauci's own past public statements. Paul essentially created a side-by-side comparison. What was Fauci saying publicly? And what was reportedly being discussed privately? That distinction became the foundation of the entire confrontation: the COVID origin debate. Let's start with one of the biggest questions of the pandemic. Where did COVID-19 come from? For years, the public heard repeated explanations, emphasizing natural transmission and the Wuhan wet market. Paul played clips of Fauci discussing the possibility that the virus had jumped from animals to humans through a wet market. The argument was straightforward. Wild animals can carry viruses. Humans come into contact with those animals, and viruses can cross from animals into humans. That is absolutely a legitimate scientific possibility. But here's where Paul's criticism comes in. He argues that private communications from early in 2020 appeared to show Fauci and other scientists considering the possibility that the outbreak did not originate at the wet market. And that's a very different picture. Public statements versus private concerns. This is where transparency becomes important. If government officials are privately discussing one possibility while publicly presenting another as the overwhelmingly likely explanation, Americans deserve to know why. Now, to be fair, scientists were dealing with an emerging virus in real time. Nobody had perfect information in January 2020. That's an important point. Science evolves. Evidence changes. Hypotheses get revised. That's normal. But when the government tells millions of people what they should believe, transparency becomes essential. If officials aren't certain, they should say they're not certain. If multiple possibilities are being investigated, the public should know that. And if new evidence changes the assessment, officials should explain why. That's how you maintain credibility. The wet market evidence. Paul also challenged the strength of the wet market explanation. He pointed to testing that, according to his presentation, failed to find an infected animal at the market. He also argued that viral material found at the market could have resulted from human transmission rather than proving that an infected animal transmitted the virus to humans. Now, this is where we need to be careful. The origins of COVID-19 remain a heavily debated scientific and intelligence question. Evidence has been interpreted differently by different researchers and agencies. So the responsible takeaway isn't, "We now know exactly what happened." The responsible takeaway is, there were, and remain, serious questions that deserve investigation. And those questions shouldn't be dismissed simply because they're politically inconvenient. Natural immunity becomes the next battle. Then Rand Paul shifted to another controversial subject: natural immunity. This is where his criticism becomes especially personal. Paul argued that public health officials failed to properly communicate the protection people could receive after recovering from COVID. His argument wasn't that natural immunity was perfect. In fact, he explicitly acknowledged that it wasn't. His argument was that it was a useful layer of protection that should have been incorporated more effectively into public health policy. And I think that's an important distinction. Science doesn't have to be all or nothing. Something doesn't have to provide 100% protection to have value. What happened to recovered patients? Paul told the story of a man whose family had already recovered from COVID, but whose wife later became seriously ill. According to Paul's account, the family was still prevented from visiting her in the hospital. That story raises an emotional question. Did pandemic policies sometimes fail to account for individual circumstances? The answer deserves serious discussion. Policies created during emergencies can have unintended consequences. And when those policies involve elderly people, hospitals, nursing homes, and families, the consequences can be enormous. Nursing homes and natural immunity. Paul then presented his argument about nursing homes. His point was that recently recovered people might have provided an additional layer of protection in high-risk environments. Instead of treating everyone as though they had exactly the same risk profile, policymakers could have considered immune status alongside age, health, vaccination status, and other factors. Again, reasonable people can debate the effectiveness of specific strategies, but that's exactly why open discussion matters. You shouldn't be afraid to ask, what worked? What didn't work? What should we do differently next time? The problem with "we didn't know," one of the biggest defenses of pandemic-era decisions is, we didn't know. And that's partly true. At the beginning of a new pandemic, nobody has perfect information. But there's a second principle that matters just as much. When you don't know, be honest about what you don't know. Don't present uncertainty as certainty. Don't treat legitimate scientific disagreement as misinformation simply because the debate is uncomfortable. And don't punish people for asking questions that eventually turn out to be worth asking. That doesn't mean every theory is correct. It means evidence should determine which theories survive. Steroids and treatment decisions. Paul also criticized the way certain treatments were discussed during the pandemic. He specifically highlighted steroids, arguing that they ultimately demonstrated significant benefits for certain seriously ill COVID patients. This is another important lesson. Medicine is supposed to evolve based on evidence. A treatment can appear promising. Then trials can show whether it actually works. Some treatments succeed, others fail. Some become standard practice. Others disappear. That's normal medicine. The problem arises when politics gets mixed into the process. The bigger question, did politics influence science? This is where my concern as a conservative comes in. Science should not belong to Republicans. It shouldn't belong to Democrats. It shouldn't belong to presidents. And it shouldn't belong to government agencies. Science belongs to evidence. Government officials should use scientific evidence to make policy decisions, but scientists should also be willing to admit when the evidence is uncertain. During COVID, however, the public often saw political battles over scientific questions, and that damaged trust. Americans started asking, are we being given the complete evidence? Are officials acknowledging uncertainty? Are alternative hypotheses being investigated? Are political considerations influencing scientific communication? Those questions are legitimate. The gain-of-function debate. Then Rand Paul moved into perhaps the most controversial issue of the entire discussion, gain-of-function research. This is a subject that has been debated intensely for years. The basic concern is whether research involving potentially dangerous pathogens can create risks that outweigh the benefits. Supporters argue that carefully controlled research can help scientists understand viruses and prepare for future outbreaks. Critics argue that some experiments could create unacceptable risks if something goes wrong. And here's the point. Both sides deserve to be heard, because the consequences of a laboratory accident involving a dangerous pathogen could be enormous. Can laboratory accidents happen? Paul referenced previous incidents involving laboratory-associated disease outbreaks and used those examples to argue that laboratory accidents aren't merely theoretical. That's a fair question to ask. Whenever humans work with dangerous pathogens, there is some level of risk. The question is, how much risk is acceptable? What safety standards should apply? Who oversees the research? Who audits the laboratories? Who pays for the research? And what happens if something goes wrong? These aren't conspiracy questions. They're basic questions about risk management. Accountability goes beyond Fauci. And that's why I don't think this debate should simply become, Fauci versus Rand Paul. The bigger issue is institutional accountability. If American taxpayer money supported research involving dangerous pathogens, Americans deserve to know: where did the money go? Who approved it? What research was conducted? What safety procedures existed? What oversight occurred? And were officials completely transparent with Congress and the public? Those questions should be answered regardless of which political party is in power. The intelligence question. Another major issue is whether government agencies knew more about the origins of COVID than they publicly acknowledged. If intelligence agencies had evidence supporting different possibilities, Americans deserve transparency about what can legally be released. Of course, legitimate national security information may need to remain classified, but classification shouldn't become an excuse for avoiding accountability. Where information can be released safely, it should be, because the longer questions remain unanswered, the more distrust grows. What about Fauci's legacy? Now let's talk about Dr. Fauci himself. For decades, Fauci was one of America's most prominent public health officials. During COVID, he became the face of America's pandemic response. Millions of Americans watched him on television. Presidents listened to his advice. Governors referenced his guidance. Schools and businesses were affected by policies influenced by public health recommendations. That level of influence creates a huge responsibility. And when someone becomes that powerful a public figure, scrutiny comes with the territory. That's not persecution. That's accountability. But let's keep this honest. At the same time, we shouldn't turn political criticism into misinformation. There are still unresolved questions surrounding COVID's origins. There are competing interpretations of the evidence. There are legitimate scientific disagreements about aspects of pandemic policy. And there are claims made by politicians that should be independently verified. That's why I don't think Americans should simply accept everything Rand Paul says because he's a senator. And they shouldn't automatically reject everything he says because he's a Republican. Look at the evidence. Look at the documents. Look at the scientific literature. Look at the timelines. Then make up your mind. That's how an informed citizen should approach this. The lesson from COVID. If there's one lesson we should take from the pandemic, it's this. We need institutions that can admit mistakes. Nobody expects officials to predict the future perfectly, but Americans should expect honesty. If you made a mistake, admit it. If your original assessment was wrong, explain why. If new evidence changed your position, tell the public. If a policy had unintended consequences, acknowledge them. And if government money was used improperly, investigate it. That's not weakness. That's leadership. What happens during the next pandemic? And here's perhaps the most important question. There will be another pandemic someday. Maybe not tomorrow. Maybe not next year. But history tells us that infectious diseases will continue to emerge. When the next one arrives, Americans need to trust public health institutions. But trust cannot simply be demanded. It has to be earned. The next generation of public health leaders needs to understand that. Transparency needs to be built into the system. Scientific disagreements should be allowed. Data should be published. Conflicts of interest should be disclosed. Government funding should be traceable. And oversight should happen before a crisis becomes a catastrophe. My final take. Personally, I believe Rand Paul's questions deserve serious consideration. Not because every accusation is automatically true. Not because Fauci is automatically guilty of everything critics accuse him of. But because the questions involve matters of enormous public importance. COVID changed America. It changed healthcare. It changed education. It changed businesses. It changed government. It changed how Americans interact with one another, and millions of people suffered enormous losses. That means Americans deserve to know what happened. They deserve to know what officials knew. They deserve to know when they knew it. And they deserve to know whether mistakes were made. Most importantly, they deserve to know whether those mistakes will be repeated. Final thoughts. Folks, this hearing demonstrates why congressional oversight matters. Rand Paul challenged the official narrative on COVID origins, questioned pandemic policies surrounding natural immunity, raised concerns about gain-of-function research, and demanded greater accountability. Some of his claims remain disputed. Others deserve further investigation. But the fundamental principle is simple. Ask the questions. Follow the evidence. Publish the facts. America doesn't need government officials who pretend they never make mistakes. America needs leaders who are willing to admit mistakes and learn from them. And if we're going to face another pandemic someday, we'd better learn the lessons from COVID before the next crisis arrives. So what do you think? Did Rand Paul raise legitimate questions about America's COVID response, or do you think his criticism goes too far? Drop your opinion in the comments. And if you believe Americans deserve transparency and accountability from their government, make sure to like this video, share it with your friends and family, and subscribe to Congress Daily Report. Turn on that notification bell so you don't miss our next political breakdown. Thanks for watching Congress Daily Report. Stay informed, stay engaged, and I'll see you in the next report.